Podiatric Medical Association. Tonight we are going to be talking about athletic foot injuries and the variety of injuries that people who are active and exercising and playing team sports or individual sports like running and things like that encounter. With me tonight is she's got a lot of athletic training and podiatric medical experience, including working with numerous Olympic, professional, semi-professional, and elite athletes, including runners, triathletes, dancers, skaters, gymnasts, and soccer and volleyball players. Mm-hmm. She was actually one of the podiatrists that worked in the 1996 Olympic Games. I'm sure that was medical college too, and gave a lecture there today. So
I did.
So that'll help us today too. You are triple board certified.
Correct.
In surgery, orthopedics, and primary podiatric medicine. You're a fellow of the American College of Foot and Ankle Surgeons and of the American Academy of Sports Medicine. So welcome to Feet Forward. Exercise program for a lot of people who are just getting started. And so this show really builds on a lot of that information. Mm-hmm. We're talking about the more advanced athlete here, someone who's got a regular exercise regimen, perhaps a runner. And the more you exercise, as you know, the more kinds of injuries you're going to incur. And so one of the first things talking about, probably the most important athletic piece of equipment that an average person can buy, and that's a shoe.
Correct.
So we're going to go into a little bit of detail about that. So first we're going to talk about heel injuries, and I'm going to I'm going to show a little graphic here of the heel. And why don't you tell me about some of the common heel injuries?
We have quite often the heel injury that we usually have is traditionally called plantar fasciitis. Plantar fasciitis is an injury of that thick fibrous band that comes from the bottom of the heel and spans all the way forward to the ball of the foot. Right here. And that band will get injured when you increase your activity, if you are wearing worn out or old and carrying more things. So sometimes people have children and start carrying and lifting their kids. Sometimes people start carrying a big heavy laptop to work. So those are some of the things that you can incur. Having the plantar fasciitis will kind of come from those potential problems. Very, very uncomfortable in the morning. It's very sore if you sit and get up. Activities and very sore in the morning and after sitting and getting up.
Yeah, I had plantar fasciitis a couple of years ago. And why is it that it hurts in the morning, but not like after you've been working out? So my problem was I'd work out, I'd feel fine. It went away. There's no problem. And then the next morning I wake up, oh my God, what pain! Right. Why is that?
Well, typically the plantar fascia. When you get out of bed in the morning and you put your foot down, it spreads out, your arch collapses, and that's usually what causes the problem. The same thing happens if you sit for a while in the car and get up. So typically, classically, plantar fasciitis has those symptoms: getting out of bed in the morning or sitting and getting up.
Okay. And typically when you see a patient for the first time,
simple things at home. You can do some icing, you can do some stretching of your Achilles tendon. You want to go ahead and just stretch up against the wall and make sure that Achilles tendon is stretched out. You can certainly do some anti-inflammatory medicines if you're if medically everything's okay there. Certainly buying some over-the-counter inserts can certainly the early symptoms that you have may not be enough, and you may need to contact your local podiatric physician, but sometimes you can just get rid of some of those simple problems with some simple home remedies.
And when they enter your office, after they've tried all those conservative methods, then what kinds of things are you looking at?
Well, occasionally we'll a little bit more specific arch strappings and or maybe some orthotic devices which support the foot and hold the arch up. And very rarely does this ever have to go into a surgical intervention. So generally conservative care, sometimes a little physical therapy can help, and a little bit of massage therapy. So well, it's best that you don't run. It's best that you don't do a lot of fitness walking. If you can do some cross training with bicycle riding or swimming or maybe an elliptical trainer, those are the things that I will recommend for my runners and athletes. Holding off on that little extra walking will really make this move along a little faster, for sure.
And what kind of time frame are we looking at for this?
I always tell patients that with the typical garden variety plantar fasciitis, it may be up to a few months to really, really knock it out and get it to the point where you just don't have any pain. Sometimes you get patients that have had it for a long time and they haven't come into the doctor's office. It can be upwards of 6 to 8 to 12 months even for some unfortunate patients, but so.
Great. So let's talk about some of the other injuries that you see. And you see a lot of kids too. And now that we're entering Little League season and soccer season, you're going to start to see a lot of athletic injuries, sprained ankles, Achilles tendons, problems and things like that. Tell me some of the more common injuries you see for kids, and talk about how differently
heel pain that we see with the kids coming in is, we'll put a picture up here, is more of a growth plate issue. Children in the little, 8 to 10 to 12 years of age who are playing lots of soccer and different sports, that growth plate on the back of the heel tends to be the thing that gets sore and irritated, and the kids will self-limit with some simple treatments and will go away. Very rarely would it be a little bit more advanced or a little more of an issue with anything other than just conservative care. But that's the common thing that we see in the kids when they're playing lots of sports and the growth plate gets irritated.
And do kids typically grow up?
But heel cups and heel padding, some icing if the parents feel comfortable doing a little kids pediatric Tylenol or Advil, certainly that could be something that they can use. Typically I'll recommend not to do that before their sporting activity because it may mask a little bit of the pain, but maybe before they go to bed at night or something along those lines.
And how would what advice would you give parents in terms of when they should take their child in to see a podiatric physician or their pediatrician, for instance, versus what could I treat at home reasonably?
Well, I think that with any injury, whether it's a child or an adult, if you try some simple conservative care and you're not getting podiatric physician or such, and make sure that there's not something more advanced going on, with a particular sports injury. But certainly very simple ice and some stretching and some